So we are going to speak today about the muscle of the thoracic wall. The muscle of the thoracic wall, including the intercostal muscles, the pectoralis major, minor, serratus anterior, rectus abdominis, external oblique, internal oblique, and transverse thoracic and transverse abdominis. All of these are regarded as the muscle of this thoracic wall. So we have the intercostal spaces. The intercostal spaces are an interval between the ribs and the costal cartilage. They are 11 on each side posteriorly. Anteriorly, we have 9 intercostal spaces because we have the 2 floating ribs, 11 and 12, does not reach the sternum anterior, so we have 2 missing spaces anteriorly, but posteriorly they are 11 spaces. Each space is lying below the numerically corresponding rib. So if we have, this is rib 1, so the space below rib 1, intercostal space 1. Rib 2, the space below will be intercostal space number 2. Each space is occupied by intercostal muscle, membranes, nerve, arteries, and veins. The intercostal muscles and membrane. The first muscle we have the external intercostal muscle. This take origin from the lower border of the rib above at the level of the tubercle of the rib. It extends obliquely downward and forward. Very important to focus on this. Downward and forward, to be inserted in the upper border of the rib below. It's replaced by external intercostal anteriorly. So it doesn't reach the sternum, it's replaced by membrane, which we call it the external aponeurosis or the external intercostal membrane. At the level of the costochondral junction, its action is to elevate the rib. So we have here, this is the external intercostal muscle. It's running downward, forward, from posterior, go till the level here at the junction between the rib and the costal cartilage. So the muscle stop here and then replaced by aponeurosis or membrane. An internal intercostal muscle, it originates also from the floor of the costal groove of the rib above, close to the lateral margin of the sternum, and pass downward and backward. So the direction of fibers here is downward and backward, to be inserted in the upper border of upper margin of the rib below, and it is replaced by internal intercostal membrane at the level of the angle of the rib. So it depresses the ribs. So again, you can look here at the level of the sternum, look at the direction of the fibers here. So this is the internal intercostal muscle from here till the level of the angle behind posterior, so it doesn't reach the vertebra. It's replaced also by posterior intercostal membrane or aponeurosis. So it depresses the ribs. The transverse intercostal muscle, also called the sternocostallis muscle. Here it takes origin from the lower third of the posterior surface of the sternum, the xiphoid process, and the 4th to the 7th costal cartilage. Its fiber passes upward and laterally and inserted by dividing into slips into the 2nd to the 6th costal cartilage. The lower slip continues with the transverse abdominis muscle. The action is to depress the upper costal cartilage. So here this is the intercostal space, this is the rib and this is another rib. Here the first muscle, we can see the external intercostal muscle, and here this is the internal intercostal muscle, and inside we have the innermost intercostal muscle. As we can see, between the innermost intercostal muscle and the internal intercostal muscle, we have the neurovascular bundle, which intercostal vein, intercostal artery, and intercostal nerve. Remember the vein, artery, and nerve. which occupying here the costal groove of the rib. So the transverse intercostal muscle related internally to the endothoracic fascia and parietal pleura, and externally to the intercostal nerve and vessels. The transverse intercostal muscle can be divided into three portions, more or less separated from one another: the subcostalis, which is posteriorly, and intercostalis intimus, which is laterally, and the sternocostalis, which is anteriorly. So the transverse intercostal muscle, it has three parts: posteriorly, so we call it subcostalis; laterally, we call it intercostalis intimus; and anteriorly, we call it the sternocostalis. The endothoracic fascia is a thin layer of a loose connective tissue that separates the parietal pleura from the thoracic wall. The suprapleural membrane is the thickening of this endothoracic fascia. So the suprapleural membrane is very important, so we should know it very well. This is a tent-shaped fibrous sheet attached to medial border of the first rib and costal cartilage laterally, and attached to the transverse process of the 7 cervical vertebra at the apex, and medially it's attached to the fascia investing the structure passing from the thorax to the neck. Its function is to protect the underlying cervical pleura, resist the change in interthoracic pressure occurring during respiratory movement. As you can see here, this is the suprapleural membrane, which is thickening of the endothoracic fascia. Here, this is the apex of the lung, so it's protecting it. And here, this is the trachea, this is the sternum, and the first rib. The neurovascular spaces. The neurovascular space is the plane in which the neurovascular bundle intercostal vein artery nerve course. They lie between internal intercostal and innermost intercostal muscle, as we mentioned before. So we should remember the vein, which is from above downward. So the nerve supply of the chest wall. The intercostal nerve are the anterior primary rami of the thoracic segmental nerve. All the upper 6 intercostal nerves run in the intercostal space. The remainder gaining access to the anterior abdominal wall. So the upper 6 only supply the skin of the chest, and the lower part of the lower 6 supply the anterior abdominal wall. So the branches of the intercostal nerve, including the cutaneous branch, which is anterior and lateral branches, the collateral branch here, which gives the intercostal nerve, and we have the sensory branches to the pleura and the peritoneum. We have some acceptation, which is the first intercostal nerve, which joins the brachial plexus. As we know, the root of the brachial plexus from C5, C6, C7, C8, and T1, and has no anterior cutaneous branch. The second intercostal nerve is joined the medial cutaneous nerve of the arm by the intercostal brachial nerve and supply skin of the armpit or axilla, and the medial side of the arm. So the vascular supply of the chest wall. The intercostal spaces receive their arterial supply from anterior and posterior intercostal artery. The anterior intercostal artery, which run in the anterior intercostal spaces, so all the branch from the internal thoracic artery. The upper 6 intercostal spaces, their artery came from the internal thoracic artery, and the lower 3 from the musculophrenic artery. Regarding the posterior intercostal, the lower 9 posterior intercostal spaces receive their blood supply from the thoracic aorta, but the first and second posterior intercostal artery, they came from the superior intercostal branch of the costocervical branch from the second part of the subclavian artery. And also the vein, the anterior intercostal veins drain into the internal thoracic, upper 6, and musculophrenic, the lower 6. The posterior intercostal vein drain into a zygous vein, right side, and hemiazygous vein into the left side. Here we can see this is the internal thoracic. You can see the upper 6 spaces from the internal thoracic, and here we have, this is the musculophrenic, which supplies the lower 3 spaces anteriorly. Regarding posteriorly, we have the lower 9 spaces, direct branch from descending thoracic aorta, and the upper 2 spaces from the costocervical from the second part of the subclavian. The posterior intercostal veins in the right side, they drain into a zygous vein. In the left side, they drain into the hemiazygous vein, lower part, and the upper part drain into accessory hemiazygous vein. And here this is the lymphatic. As we see, this is the cisterna chyli, carries the lymph from the abdomen entering the diaphragm and changing to the thoracic duct. So the lymphatic drainage, the anterior chest wall drain into the anterior axillary node, the posterior chest wall drain into posterior axillary node, the anterior intercostal drain into the internal thoracic, and the posterior intercostal drain into para-aortic node. So thank you so much.